The notion of nursing as a form of caring science as opposed to medical science is significant. The Caritas process number 4, developed by Jean Watson, discusses how the process of developing and sustaining a helping, trusting, authentic, caring relationship can result in a whole healing environment for patients as well as nurses involved in healthcare. Within this framework, the focus of authenticity and genuine interest in yourself, in your patients, and in your practice as a nurse allows for healthcare workers to provide effective care for patients. In the emergency room, I don't have a lot of time with patients, so I feel that the more authentic and genuine I am, as well as the quicker I can develop trust with my patients through efficient and empathetic care, allows me to be more effective. This process involves the idea of a relationship between yourself, the patient, the community at large, and other practitioners or coworkers that you're coming into contact with. These 4 components allow nurses to provide the most effective care when there is a balance between all 4. So knowing that you must first care for yourself before you can take care of a patient and before you can provide care to a community, as well as be effective with other coworkers, provides a framework where we can be the most effective. We understand that humanity and how people want to be treated elicits a framework for developing relationships revolving around caring, which is defined as a human trait, a moral obligation, an interpersonal relationship, and well as therapeutic interventions. This notion of caring being all-encompassing allows us to provide effective care for patients. I think if we can find a way to apply this process, it will deepen our humanity and allow us to become more authentic and genuine with ourselves, with our patients, again, with coworkers, and everyone around us in the community. This notion of authenticity and genuine consideration allows us to become more humane, provide the most compassionate care, and allows us to begin to develop an awareness of ourselves and those around us, including all the factors that have contributed to who we are, why we're here, and what we're to do with the situation that we're in. Furthermore, it develops a sense of presence, where we as nurses must listen. Again, reading the room or knowing the situation that you're in allows you to know your patients better, knowing yourself and what kind of a day you're having, for example, so that you can be the most efficient and effective with your patients, allows for a sense of presence to be effective. As well as presence comes this concept of being mindful, where we can be reflective, respectful, considerate of our language and how we speak to others, how we speak to ourselves, how we speak to the other staff around us. All of these things allow us to build a relationship based on trust and confidence. This not only allows us to be more effective in our care, but also allows our care to be more effective, meaning that if a patient is confident in the things that we do and the interventions that we are offering or the education we are providing regarding procedures or treatments, they will be more open. The idea of this process I believe goes beyond just the physical. This is more of a, again, relational system, whereby the quality of our relationships, that dictates the effectiveness of our care that we're able to provide. The more effective our care, obviously, the better for patients. They have an increased healing. They have decreased morbidity and mortality. The notion of relationships and connections really dictate the healing process, more so than the physical interventions or modern medicine, so to speak. Again, we focus on quality care, maybe over quantity. So rather than worry about the number of interventions we can provide to a patient, it's more effective sometimes to spend time, or to spend quality time. Whereas we can facilitate patients' healing, enhance clinical outcomes, improve patient responses to treatment, all through our effective, authentic communication with our patients. In order to be this individual and provide this sort of relational experience, I feel that we have to understand the emotions and experiences that as practitioners we have going on within ourselves, and as our patients are feeling and experiencing, whether it be just now in the moments that we care for them, or even in the moments leading up to the experiences. All of these things sort of guide our practice and guide the relationships that we form with our patients. We have to become, being, and live within the work that we are doing. As nurses, we are called to provide a service to ourselves and to society, the community. We sort of have to go beyond this conventional practice and be a part of the moment or the situation and a part of this patient's lives in order to facilitate healing, and sort of step outside of maybe traditional practices or traditional medicine in order to become the work and provide the care that our patients require. When we do this, I really truly believe that we are able to develop a greater sense of personal and professional satisfaction. We feel more fulfilled in the work that we do. We may really enjoy our jobs more, and develop a true sense of authenticity within ourselves and within our patients, or to our patients around us. Thank you.